Today, we are diving deep into a really complex condition called dystonia. It's a movement disorder that can be tough to get your head around, let alone manage. We're going to break down what it is, and then we'll walk through what's often called a stairway of intervention, from the very first medications a doctor might try, all the way to advanced brain surgery.
So, let's start with a basic question. I want you to imagine for a second. What would it feel like if your muscles just stopped listening to you? You try to make a simple movement, but instead, they just contract on their own, twisting your body into strange, sometimes painful postures. That's the core of what we're talking about today.
So, here's our game plan. We're going to climb that stairway of intervention together. First, we'll spend some time really decoding what dystonia is. Then, we'll start at the bottom step with first-line medications, move up to more targeted therapies, and then get to the really advanced stuff like deep brain stimulation, or DBS. And finally, we'll talk about what happens in a worst-case scenario, a full-blown dystonia crisis.
All right, first things first, we have to decode dystonia. Before we can even think about treating it, we've got to understand what's actually going on with these rogue muscle signals.
Okay, so here's the textbook definition. Dystonia is a movement disorder where you get these sustained or on and off muscle contractions. And those contractions cause abnormal, often repetitive movements, or they lock the body into weird postures. Or sometimes you get both. The key thing to remember is that this isn't a problem with the muscles themselves. The problem is in the brain's signals telling the muscles what to do.
Now, this brings us to a really important point that often causes confusion. Dystonia is not a seizure. I mean, the movements can look dramatic, right? But with a generalized seizure, you typically have a sudden onset and lose consciousness. Dystonia is different. It tends to build up more slowly, sometimes over hours or even days. And crucially, the person is awake and aware the whole time. The movements themselves are all over the place. They're not rhythmic. Getting this distinction right is absolutely vital in an emergency.
So now that we have a clearer picture of what dystonia is, let's take that first step onto our stairway of intervention. We're going to start with medications.
To keep things simple, neurologists have come up with a handy way to think about the main oral meds. You can just think of it as the ABCD rule for dystonia medications. It's a really easy framework to remember.
And here they are. A stands for anticholinergics, which basically block the go signal to your muscles. B is for baclofen, which amps up one of the brain's calm down signals. C is for clonazepam, which works on another calm down signal. And finally, D is for dopaminergic agents like levodopa. And that last one is super important because some rare types of dystonia respond amazingly well to levodopa. So it's pretty much standard practice to give a trial of this drug to every child who has dystonia without a known cause.
Let's dig into those A drugs for a second. Anticholinergics are often one of the first things a doctor will try. They work by blocking a chemical called acetylcholine. You can think of acetylcholine as the brain's go signal to the muscles. So these drugs essentially put up a roadblock to stop that signal, which can help calm down those unwanted contractions. Of course, there are trade-offs, like side effects. Think dry mouth or feeling irritable.
Now, on the flip side, you have the calm down signals, the brain's main brake pedal. Its primary chill-out chemical is called GABA. And both baclofen and benzodiazepines, your B and C drugs, work by boosting GABA's effect. They just latch on to slightly different parts of the system. The goal is the same, though, to quiet down that overexcited motor system. The downside here is that they can often make you feel pretty drowsy or tired.
Okay, but what happens when those pills aren't doing enough, or the side effects are just too much to handle? Well, that's when we climb to the next step on the stairway, targeted therapies. These are all about precision.
So you've probably heard of botulinum neurotoxin, or BONT, maybe for wrinkles, but it is an incredibly powerful medical tool. For dystonia, it's injected straight into the specific muscles that are overacting. You can think of it like a temporary circuit breaker. It goes right to the source and stops that go signal, acetylcholine, right where the nerve connects to the muscle.
The real magic of Boton is just how precise it is. It creates this targeted chemical denervation, which is a fancy way of saying it temporarily disconnects the nerve signal. It inactivates the exact proteins the muscle needs to contract, and this gives targeted relief for several months. And it's not just about stopping the movement. It can be a game changer for controlling pain, improving function, and even making day-to-day care a whole lot easier.
Hey, remember baclofen, the oral calm-down drug? Well, one of its biggest problems is that only a tiny fraction of the pill you swallow actually makes it into the brain where it needs to work. So, intrathecal baclofen, or ITB, is this really clever solution. It uses a surgically implanted pump to deliver the medicine directly into the spinal fluid. It completely bypasses the blood-brain barrier. This means you can get a way stronger effect with doses that are sometimes 100 times lower than what you take by mouth.
All right, we've now climbed to the top of our stairway. We're moving from chemistry to electricity. We're talking about the pacemaker for the brain, deep brain stimulation, or DBS.
DBS is a type of brain surgery that's considered when other therapies just aren't cutting it. Surgeons implant these incredibly thin wires, or electrodes, into very specific deep parts of the brain. Those wires are then connected to a device, kind of like a heart pacemaker, that sends gentle electrical pulses to help regulate the faulty brain circuits that are causing the dystonia.
So, who is this for? Well, the most common spot they target in the brain is a structure called the globus pallidus pars interna, or GPI. The people who tend to see the best results are often those with specific genetic types of dystonia. And one of the biggest predictors for success is how long you've had the condition. The shorter the duration before surgery, usually the better the outcome. The results can be absolutely life-changing, but it's not a silver bullet. The response really varies from person to person.
And that really brings us to a major takeaway here. Treating dystonia isn't about finding the one best option. It's about building a whole strategy. You've got your oral meds as the foundation. You can add something like BONT to zero in on specific problem muscles. And for the more severe, widespread cases, you have these powerful neurosurgical tools like DBS and ITB. It's a layered approach, and it has to be tailored to each individual.
Okay, last but certainly not least, we need to talk about the most serious situation you can face with dystonia, a crisis. This is a true medical emergency.
This state has a name. It's called status dystonicus, and make no mistake, it is a life-threatening condition. It's when the episodes of generalized dystonia become more and more frequent and more severe, to the point where you need to be in the hospital urgently. The stress on the body is just immense and can lead to all sorts of serious complications.
There's this quote that I think just perfectly sums up the #1 rule of managing a crisis. It is difficult to put a fire out if fuel keeps getting thrown onto it. Before you can even begin to calm the dystonia itself, you have to find what's fanning the flames. You have to find the trigger.
And that fuel for the fire can be almost anything, seriously. The common triggers range from things you'd expect, like an infection, or a change in medication, or major stress, to things you might not think of, like a dental issue, or even just being constipated. Finding and treating that trigger is always step one.
To deal with this emergency, doctors use another ABCD mnemonic. And it's important to know all of this happens at once. A is for address the precipitant, find and treat that trigger we just talked about. B is for begin supportive care, like getting fluids and pain relief on board. C is for calibrate sedation, basically using medicines to help calm the whole system down. And D is for adjusting the dystonia-specific medications.
Wow, so we've gone all the way from just trying to understand those rogue signals to managing the most extreme crises. You can really see a trend here, right? From generalized medications to these incredibly precise interventions like DBS that target specific brain circuits. It really makes you wonder, and this is the thought I want to leave you with. As we get even better at fine-tuning these brain circuits, what is dystonia treatment going to look like in 10 years?